Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the duodenum. Duodenum is a part of small intestine. The first part of the small intestine is called duodenum, and duodenum has the following identifying point. Like other part of the small intestine, we have mucosa, submucosa, inner circular smooth muscle layer, outer longitudinal muscle layer, and in the first part of the duodenum we'll also get the serous layer. In the duodenum we have the lining epithelium like other part of the small intestine by simple columnar epithelium, lamina propria, there is a loose connective tissue, muscularis mucosa, that is a smooth muscle, thin smooth muscle composed of two layers, inner circular, outer longitudinal layer. Submucosa contains the tubuloalveolar mucus secreting gland that is also alkaline in secretion. That is called Brunner's gland. That is very important for diagnostic purpose. So if you go there, we'll find out the layers of the duodenum. This is the lumen of the duodenum. This is the mucosa. Mucosa has some modification. We have the villi here. We have villi. We have also edge hole modification, permanent mucosal fold or bumps of cork ring. And here we are seeing numerous villi. So the mucosa is composed of the lining epithelium, lamina propria that enters into the villi, and this is the muscularis mucosa, inner circular layer, extend to the villi. And then after the muscularis mucosa, we have the submucosal layer. The most important identifying point for the duodenum is the submucosal gland. These are the tubuloalveolar gland. They are mucus secreting, alkaline secreting glands, and these are called Brunner's gland. These are the Brunner's gland. This is very much characteristic for the duodenum. Other part of the small intestine does not have the submucosal gland. Okay, like this. This is only present in the duodenum. Then we get the muscle layer, the inner circular muscle layer. Then we have connective tissue in between the muscle layer. We have the outer longitudinal muscle layer. Then we may get serous layer if the section of the duodenum is taken from the first part of the duodenum, even the fourth part of the duodenum close to the duodenum junction. Okay, otherwise duodenum is mostly retroperitoneal structure. We will not get the serosal layer. We'll get just connective tissue. We may call it adventitia. Okay, we got the identifying point. Now we'll find out that the structure of the villi is lined by the simple columnar epithelium. We have also a lot of other goblet cell here, other cells. We have another four types of cell, and here I am seeing the light stained area. These are the goblet cell or mucus secreting cells. These are unicellular mucus secreting cells that is present throughout the small intestine. It is more prominent in the ileum than that of the duodenum, and the villi is very prominent in the duodenum, taller and numerous in the duodenum than that of the jejunum and the ileum. So villi are finger-like projection lined by simple columnar epithelium. We have also the epithelium has also modification of the cell membrane. We have the microvilli. We call it striated border. We have numerous microvilli. So permanent fold of the small intestine like bulb of Karking. the villi and the microvilli increases the surface area many times the exact surface. Okay, so we have the intestinal gland. These are tubular gland. We call it crypts of Lieberkuhn. This is the crypts of Lieberkuhn. This is the submucosal gland or the Brunner's gland. Brunner's gland opens into the base of the crypts of Lieberkuhn. It penetrates the muscularis mucosa. Sometimes Brunner gland duct may open in the intervillar space. The crypts of Lieberkuhn opens by the side of the crypts of by the side of the villus in the intervillar space. But Brunner's gland mostly open into the base of the crypts of Lieberkuhn or the intestinal gland. So intestinal gland are also called crypts of Lieberkuhn. The Brunner's gland also secretes a hormone called urogastron. The hormone from the urogastron actually decreases the secretion from the parietal cell and maintains the pH in the duodenum. The microvilli over the epithelial cell has glycocalyx covering as a protection from autodigestion. Okay, so this is the villi. These are the lining epithelium, simple columnar epithelium. This is the core of the villi that is composed of lamina propria, lacteal. This is a lacteal here. This is a blind ending lymphatic vessel. Okay, we got that. This is lamina propria. This is rich in the connective tissue cells and blood vessel. Plus, we have scattered lymphocyte. We may even get lymphatic nodule in the lamina propria. But in the lamina propria here in the villi, it is containing lacteal. It is containing blood vessels as to support the function of the duodenum. Okay. Here, the histology of the duodenum, we find that this is the villi. One is villus, multiple is villi. It is the villi contain the lamina propria, goes there entire part, and in the lamina propria we have the lacteals. Okay, we have the lacteals here. This is the lacteal here. This is the blind and the lymphatic tissue. We have the blood vessel, the capillary, and the vein, small vein, artery vein here. And we got the smooth muscle. This smooth muscle is coming out the inner circular layer of the muscularis mucosa. Okay. Then in the submucosal area, we should have the Brunner's gland. They are not shown here. Okay. And it also contains the submucosal plexus. That is parasympathetic plexus, mostly derived from the neuroectoderm. Okay, this is the muscle, inner circular muscle layer, outer longitudinal muscle layer. And these all are smooth muscle. In between the muscle, we have myenteric plexus, also called Auerbach's plexus. That is also a derivative of the neural crest cell. That is mostly parasympathetic fiber. Okay, so cells in the intestinal mucosal epithelium, we have multiple types of cell. Most common is the columnar epithelium, that is absorptive cell. We also call it enterocyte cells. Goblet cell, this light stained cell are called goblet cell. This is the goblet cell. It is nucleus is at the base, a lot of granules. That granules contain mucus. Its main purpose to lubricate this area of the intestine here, so of the intervillar space, and also in the crypts of Lieberkuhn area we have the goblet cell. But in the crypts of Lieberkuhn we get another type of cell, that is the Penneth cell. Okay, it has some antibacterial activity, immunological activity. It is rich in lysosome. And we have some basal cell or regenerative cell. enteroendocrine cell, or acute cell amine precursor uptake decarboxylase cell that has some paracrine and endocrine functions. And we have the absorptive cell, a lot of microvilli that is called striated border, and these microvilli are the prolongation from the cell membrane of this enterocyte or the columnar cell. It increases the surface area. So villi increases surface area many times. That is also multiplied by the microvilli, and the permanent fold in the intestine also increases the surface area. Okay. So what are the highlights, identifying point? What are the identifying point for the duodenum? Again, it is composed of mucosa. Mucosa has villi. Villi has microvilli, and also the villi is lined by the simple columnar epithelium. Inside the villi we have lacteal, arterial, venual, and also we have the small artery, small vein. Also we have the smooth muscle that is coming from the muscularis mucosa. Then we'll get the submucosal layer that contains Brunner's gland. This is very specific for the duodenum. This is the most important structure to identify the Brunner's gland. This is the tubuloalveolar gland, that is alkaline secretion and mucus secretion. Villi, Crypts of Lieberkuhn are also called intestinal gland. These are tubular gland, and these cells are continuous with that of the surface cell of the duodenum. Cells of the mucosal epithelium, we found that we have 5 types of cell. Differences between duodenum, jejunum, and ileum. Duodenum has very tall, numerous, large villi. It has the Brunner's gland. Jejunum has not. Jejunum has no Brunner's gland, and the villi is smaller and more goblet cell. Here, the least goblet cell. Jejunum has more goblet cell. Ileum has maximum goblet cell. A lot of pairs patches there, and the villi size is smaller. Okay. And that's all about the histology of the duodenum. So I request everyone to support my channel. Please subscribe me, share the information with your friends. If you have any question anytime, please feel free to ask me, and have a nice day. Bye now.